So we are going to go ahead and get started. Good morning, everyone. My name is Elizabeth Aloni. I'm with Schneps Media, the largest local media company in Metro New York. We publish over 70 newspapers, magazines, websites, webinars, podcasts, and events throughout Queens, Brooklyn, the Bronx, Manhattan, Westchester, Long Island, and Philadelphia. Today, we're really thrilled to bring to you how to qualify for Medicaid, home care, and institutional benefits. Whether you're thinking of yourself or a loved one, Medicaid and finding the right care can be overwhelming. And today we have two experts to help us understand Medicaid, senior living options, and guide us to understanding. And I'm so very happy to welcome them. First, please welcome Melissa Negrin-Weiner, Esquire. Melissa is a partner of Cona Elder Law, and Melissa manages the Government Benefits Department, concentrating her practice in the areas of asset protection, Medicaid eligibility planning, estate planning, special needs planning, mediation, guardianships, and veteran benefits. She supervises the healthcare and community benefits, she supervises the preparation of Medicaid applications for nursing home care, home health care, and community benefits, resolves complex Medicaid issues, and represents families facing a reduction in Medicaid home care hours and services. Welcome, Melissa.
Thank you so much. Good morning.
We're expert with us, so we're thrilled to have you here.
Thank you.
Now, please welcome Stuart Almer, President and CEO of Gurwin Healthcare System, Gurwin Jewish Nursing and Rehabilitation Center, Gurwin Jewish Faye J. Linder Residences, Gurwin Home Care Agency, Gurwin Jewish Healthcare Foundation, Fountain Gate Gardens, and most recently, Island Nursing and Rehab Center in Holtzville. Prior to joining Gurwin in 2015, Mr. Almer served as Executive Vice President and COO at Parker Jewish Institute for Healthcare and Rehabilitation, and prior to that as Vice President Operations at Peninsula Hospital Center. Stu's also held senior management positions at Syosset Community Hospital, Brookdale University Hospital Medical Center, and Huntington Hospital. Stu is an adjunct professor in the Master's in Health Administration program at Hofstra University and previously served in a similar capacity in Hofstra's gerontology program. He often lectures to community and civic organizations on quality, leadership, the status of long-term care, and the overall state of the healthcare system, and has been a much sought-after media source for local nursing home industry information related to COVID-19. Welcome, Stu.
Great. Thank you, Elizabeth. Good morning. Nice to join both you and Melissa today.
Wonderful to have you. So let's just jump right in. Melissa, can you start with discussing home care Medicaid and how it works?
Sure. So community Medicaid or home care Medicaid, which are kind of used interchangeably, it's for people who, want to stay in their home. So they need some assistance with activities of daily living, whether it's dressing or grooming or showering or using the bathroom. They need assistance with their activities of daily living, but they want to remain in their home, or even maybe they're in an assisted living environment, but need additional help with those activities of daily living. So in those cases, we look to the community Medicaid program, which right now is in the middle of this kind of limbo with changes, which I'll talk about. But what used to be the rule with community Medicaid is you couldn't have more than $15,900 in order to qualify for the benefits. And when we talk about, resources and this $15,900, I'm talking about checking, savings accounts, money markets, CDs, regular banking accounts. I'm not talking about retirement money. So people could have a 401k or an IRA with a higher balance, and they could still qualify for community Medicaid because those retirement accounts don't count towards the resource level. So what would happen is people who had more than the $15,900, they would either set up a trust or they would transfer assets to a family member to get them down below that $15,900. There was no issue with those transfers. There was no look back. There was no penalty for moving that money. So Medicaid wouldn't turn around and say, okay, you're not eligible because you gave this money away. You could be eligible the first day of the month after you move the assets. And so we would, we would help people with their asset protection, and we would apply for Medicaid benefits. And then once the financial piece was approved, then we would deal with the managed long-term care companies and having them come in to do assessments and determine how many hours of care Medicaid is going to pay for. So it's a process. It's a financial process, medical process, and we help people through from the beginning to the end. What's changed now is in October of 2020, they now said no more. Now there's going to be a look back. Okay, now people are going to have to supply Medicaid with financial records to show what they've done with their money. And it's a 2.5-year look back, but it's being phased in. So after October 2020, anybody who's given money away will have to show their bank records starting with October 2020. Okay, so if you applied, in December, you're going to only show a couple of months, and so on and so forth until we get to 2.5 years. However, because of COVID, that was supposed to become effective on applications filed after January 1st. And then they pushed it to April 1st, and then they pushed it again. And so we're not really sure where we're going to land as far as dates go. There is this kind of 90-day rule where they can kind of push it 90 days each time. So is it going to be July? We're not sure. It's kind of tough, obviously, to do planning when you're not sure. So the real rule here is the earlier the better, no matter what, right? So right now, people who made transfers after that October 1st, 2020 date, if they apply now, they're still not going to have that penalty for transferring assets. So it's really important for people who are considering that they need some help at home, or they're in assistance and they need some help in assisted living and they need some assistance, that they get themselves in a position where they can apply sooner rather than later.
That's very important to know and to make sure that you're thinking about that. And particularly now, it sounds like this is a huge opportunity to really think about it, because there's this kind of window of unknown, but potentially opportunity to be able to get your Medicaid in order without having such a look back. Is that right?
Exactly. And there's so many rules, and obviously I could talk about it for hours, but just to try to come back, get it all into one short few minutes here. There's also rules regarding income. So somebody who's on community Medicaid, and I hear this all the time, families will come to me and say, oh, my mom won't qualify. She makes too much. And when they're talking about makes too much, they're talking Social Security, pension, IRA distribution. Medicaid says you can't make more than $884 a month. So most people make more than that.
Right.
But we can set up something called a pooled income trust to protect that excess income and make sure it's still available for the individual who needs Medicaid, but still allow them to get the benefit. So there's a lot that goes into it, a lot of planning, a lot of different techniques. And that's why this area of law is kind of so focused on, just handling these matters.
Absolutely. It sounds like a lot, which is why it's also good to have the right people helping you. I think you made a really good point that's important, is the distinction between assets and income, because those are two totally different things, right? And you have to have a plan for each. It isn't just one blanket situation.
Exactly.
So that's a really good point. Thank you for bringing that up. That's something people need to think about. Both, where are my assets? What are my assets? What am I going to do with my assets? And what is my income? And how do I manage my income? And these are all things that you help people. You can help people with all of these different things, or are there different people?
Absolutely. When we sit down with somebody, we have them fill out a questionnaire so we can see exactly how things are held, whose name they're in, what types of accounts, where their income is coming from. And we basically come up with a game plan at that initial meeting of what's going to happen to help this individual become eligible for community benefits. And of course, we talk about the healthcare piece as well, because that's something that was also tweaked a bit when these rules changed in October, that where it used to be that someone had to require assistance with at least two of those activities of daily living that I mentioned, the bathing, grooming, dressing. Now they have to require assistance with physical maneuvering, plus 3 activities of daily living. Unless they have a diagnosis of dementia, that counts as one of those activities of daily living. So it's a much bigger, issue now when assessments are done, and it's a way, obviously, that they're going to reduce hours because maybe people don't need as much help as what they're now requiring. So that medical piece is another kind of hurdle to get over, and sometimes we'll get doctors involved. Sometimes we'll have to go to fair hearing to try to increase hours because we know that they're needed, and it's just a matter of getting the right information and getting it to the right people.
So you don't want to go into this blind. I mean, because let's say your loved one or yourself need reminders to do certain things to care for yourself, that doesn't necessarily mean that you can't do it on your own, right? Isn't there a distinction there? So you have to have.
Yeah, I mean, reminding and cueing and things like that, because it's interesting. Sometimes I'll talk to families and they'll say, no, my mom can dress herself. Okay. What does she wear? Oh, she wears nightgowns all day. Okay. So she probably can't dress herself, right? She's probably just putting on the nightgown because she can't do anything else. She can't do the button. She can't do, sometimes you have to really kind of ask a lot of questions and talk about those things to kind of narrow down what the real need is for assistance.
And it's important to know the questions to ask. I think that's one of the things about having experts help you, is that you don't know what you don't know.
Right.
And if you think, she has a nightgown on and it's fine, and you're not even thinking about the buttoning and the zippering and all those kind of things that may show that she doesn't have that ability, then you may even miss her need.
Right. And that's what, I've been running this department, just government benefits, for 20 years. I mean, that comes with time, right? Because you're experiencing all these different situations and you start to learn about, I'm certainly not a medical professional, but you start to learn about all of these kind of nuances and ways, that you can really assist.
Yeah. And it can be overwhelming if you don't have someone who knows what the past has been and what the expectations are. Thank you.
Right.
So someone comes to meet with you, they put together a Medicaid plan. Stu, how does someone find the right home care? What's the problem?
Sure. So the decision making is very important. Most folks are making decisions when they're in crisis, unfortunately. That's why the need for someone like Melissa and her company's services is so important, for those who can plan for a rainy day, a change in someone's condition. And most people don't plan. So we often see people who are, use the word, in crisis, and we're doing our best to guide them. So my first advice I really give to anyone is to do any planning, do it when things are generally okay. There's time to do it because there's a lot of work to be done. It's one thing to research the opportunities that exist in terms of care. The other piece is it's finding documents, it's putting a plan together. It takes time, and you want to do it when you're able to do it. And again, not in crisis. I've been through this, unfortunately, a couple of times, and I prefer the non-stress route, or at least less stress as possible. So home care, as well as all facets of healthcare, involve a lot of careful decision making. We at Gurwin Healthcare System happen to have 2 home care agencies. One is I'll refer to as a professional agency. It's a certified agency. And one I'll refer to as a non-professional agency. So the professional agency employs social workers, nurses, therapists. That's physical therapy, occupational therapy, speech, at times respiratory therapy, nutrition management, pharmaceutical, medication management. There's a lot that goes into the professional services. Not everyone needs that. Many folks have certainly a need in the home for someone who maybe needs help with those activities of daily living. It's helping to feed, it's preparing a meal, it's getting them safely to the bathroom, into bed, out of bed, things like that are very, very important. The agencies can work well together. The fact that we have both allows us, one dovetails nicely into the other. So if someone needs professional services, but they also need the non-professional, we can provide both. So it's really assessing what someone needs. We have a welcome services line at Gurwin that allows individuals to call in when they're not sure what they need. Most of our business does come still directly from the hospital. Traditionally, that's how business comes to us.
Mhm.
But like in Melissa's case, they need to explore with the family, explore what's going on, and they can then make the best recommendations. The same thing exists here. Is someone going to benefit by being at home? Do they need assisted living with those added on supports that exist? Or are they going to the nursing home? So together we figure out a plan with individuals, and every situation is also, a bit different, and you have to really work through that to make the best recommendation for someone's health and well-being. The family is a key part of it. We also see interesting dynamics in our facilities where, we may be seeing something and the family sees something else, and we have to be in the middle and kind of work with both and educate both. But the family is a very important component, because the family will also at times see things that we're not seeing. They will help fill in the puzzle pieces that might be missing.
That's really important. I think something that you said that really struck me is about what Melissa was saying about the pre-planning, because you said you get so many referrals from the hospital, but the hospital is when you're kind of already in need. But to be able to think about this ahead of time and be able to sit down, because is this something that could let's say I come to you, let's say I'm working with my loved one, with my father, my mother. Can I make an appointment to meet with you all at Gurwin and kind of talk about what the options are and talk about, what I should be looking for? Is that something I could pre-plan? Because it sounds like that would be the best case scenario.
So that's a great question, and we do that. I mean, one can say it's never too late, but the earlier on in the process, the better. We do encourage individuals to go and take tours of facilities. During COVID, that's been a bit of a challenge to do tours. It seems to be opening up again. So a tour is very, very important, because that's an opportunity not only to see and feel, but there are questions that people need to ask when they tour, or even if they reach out. But I want to first answer your question, and that is we do provide that guidance to families who are in need. We can get a quick assessment of where they are in terms of assets and guide them, and in many cases refer them to Against or Cona, for example, for guidance and estate planning. So again, every situation's a bit different. Some are straightforward. We have individuals who reach out to us. We'll guide them in terms of what they need to do, what they need to collect, where they need to go, who they need to talk to. And some individuals enter our system within a day, and others enter our system, whether it be assisted living or our nursing home, months later. So again, every situation is just a bit different.
It's funny. It's like people think about, planning, where they want to go on vacation and, planning even their funerals ahead of time, but maybe don't think about, Medicaid and senior living ahead of time, and often wait until they're in the emergency situation where nobody's thinking clearly at that time. I mean, look, there are situations you can't help. It has to be an emergency, but to think about this ahead of time and to be able to, meet with you and your team and Melissa and her team and be able to get all these things, all these ducks in a row, so to speak, so that you're ready when emergency does strike, could be really a huge benefit to families.
And I'll say that most individuals are thinking about it, but then it's converting that over to, okay, now what are we going to do about it? And once you take that step, I think if you ask anyone, they're grateful that they did it. Sure. It's stressful. It's a barrier you have to cross. There's financial, considerations, but almost always in the end, individuals are grateful they did that they now have a plan. They now at least know where things are going. Sometimes things change, in terms of condition much more rapidly than anyone could have imagined or expect. So while you're thinking, even while you're doing, things are changing. So I think individuals, when they make choices, if they can enter into bigger systems, like a Gurwin as an example, and there are many, gives you an opportunity to have access to all of the various services. As a system, whether it's adult daycare home care, nursing home care, dialysis. Many of us have those opportunities, and we've all had challenges during COVID. COVID has changed the game in a dramatic way. I used to always comfortably recommend larger facilities, but during COVID, with potential for concerns and problems with vaccination and absolutely visitation, has changed some of my thinking. I often guide people to go to smaller facilities during COVID when things hopefully calm and go to the better. Larger facilities with greater resources are a better option. So things are kind of fluid. They do change. We're facing many continued challenges going forward.
Absolutely. Thank you. And, actually, you have a great segue in talking about assisted living and nursing homes. So I'd love to jump over to Melissa and ask you about institutional Medicaid and how that's different if one is looking for assisted living or a nursing home, and what should we understand about that?
So the Medicaid for assisted living, and I will say there's a handful of assisted living facilities that actually accept Medicaid. The majority of assisted living facilities are going to be private pay, but you can then get community Medicaid to get an aid in for some additional assistance. But for the actual room and board of the assisted living, that's typically private pay again, but for a handful of facilities, and that is covered by community Medicaid. The institutional Medicaid is going to cover the nursing home population. And, it's interesting, even though it's a tougher application in that we have to provide 5 years of records, bank records to the Department of Social Services, and go through and explain all transactions of $2,000 or more, in or out, where did it come from, where did it go, why. It's actually, I feel, an easier process than the community Medicaid piece, because the community Medicaid piece, while the application portion of it is smaller, there's so many things to coordinate. There's difficulty getting aides during COVID, for sure, getting the cases staffed, or it depends on the location of the family. If they live all the way up on the North Shore or all the way down on the South Shore, it's harder to get people to them. There's so much that goes into it and so much coordination. With the nursing home, we have to go through and we have to provide these explanations. And, if there are transactions or transfers that family members have made, totally innocent, but, there's still issues with Medicaid, that's difficult. But at the end of the day, once Medicaid is approved, the nursing home is getting paid. Doesn't matter where the nursing home is, and the income, like I said before, with that pooled trust for home care, when you're in a nursing home, unless you have a spouse in the community, all of your income is going to the nursing home, except for $50 that's put to the side for additional things that the person may need in the facility, and also to pay for their health insurance premiums. So it's like an easier kind of overall, I think, process. But, the rule really is, again, the same $15,900 rule. That's what you're allowed to have. Same rule with retirement money. You can have retirement money. If you have a spouse in the community, your spouse can't have more than $130,000, okay, in assets. And if they do, they have to sign something called spousal refusal, which is basically a letter stating that they're not going to make their extra assets available. And really, it's because they need them to live on. $130,000, on a fixed income, you need to a lot of times tap into those assets, and people who have the higher amount, they don't want to turn those over. They want to hold on to them. So they sign this spousal refusal that says they're not making it available, which allows them to go on Medicaid, but it also allows the county to come back later and say to the spouse, hey, you had more money than you were supposed to, and we want you to make a contribution. Okay. Maybe the letter's not that nice. The letter's more like, we want you to send us a check for $150,000, to this address. And so that's something to consider. Although I will say that I don't really remember the last time that spouses were, that the counties were reaching out to spouses. It's been quite some time that they've really pursued any of those situations. But that being said, people have to know about it. So the same kind of limitations with what you're allowed to have for institutional Medicaid. And again, they look back the 5 years. And, we run into situations all the time where, I have a situation where a family member, was getting married, a child was getting married, and the parents paid for the wedding, and it was a lot of money. And then something happened, something catastrophic, whether it was COVID or a stroke or just something, an accident, something that you wouldn't necessarily anticipate at that time in that person's life.
Mhm.
And now I have to explain to Medicaid why they shouldn't penalize this individual for paying for that wedding, or paying for the college education, or maybe giving the kids $30,000 for a down payment on a house because they wanted to help out the kids. These things that parents do and are lucky to be able to do. And then we have to kind of explain to Medicaid, well, it wasn't a transfer in order to qualify for Medicaid. They weren't giving away all their money so they could get on Medicaid. They were helping out their kids. And I have to tell you, it is a tough argument.
Sure.
They fight back on that. It's tough. And, we try to, and, when you were reading my bios about the complex Medicaid issues, this is the stuff that comes up. And, German reparations, and whether or not they were kept in a separate account, or if they were, put into the person's regular bank account. And does that not count now? Because typically if they're kept in a separate account, they're not counted as an asset, which is appropriate. But if you commingle them in your regular joint bank account, now you have a problem. So these kinds of things that come up, they don't come up all the time, but when they do, it's really important to make sure that you have the right advocate there for those types of things. We have to show Medicaid where the assets came from, where they went. They want to know, are there other accounts you're not telling me about, right? Or, where did the money go? Did it go to a child? Did it go here, there? And they uncover things, right? So we want to know beforehand. We want to know everything. I don't want Medicaid coming back and saying, hey, there's another bank account, because they're able to access that information. So it is a very, we coordinate with the families. We work really, really closely with the families because it's collaborative effort. Everybody has to kind of get in there, give us information, give us bank statements, copies of checks. We can go to the banks and get these things for you, if somebody's not able to do it or is having a difficult time. And I can stress to you that, doing this in crisis mode, I agree with you 1,000%, is so much more difficult, than, not that you would be not necessarily planning for Medicaid, but if somebody came in and spoke to me about setting up a trust and moving assets, because there's this 5-year look back, right? So you want to move everything 5 years before you need care, because we all have a crystal ball, right? At least I can tell them about the process, and they can say, hey, I should hold on to my tax returns, because if my kids have to try to get them, when they're in the middle of making like end of life decisions for me, it's not going to be easy. Or, hey, I should hold on to my bank records for 5 years. So the planning, it's so much more than just, planning. It's making everything easier for the family, for the children, when they're the ones, going through that crisis with you.
It's a good point. I'm 51 and I'm like taking notes in my head. I'm like, I had to do this and this and this, but it's important to think about these things, and it's so much easier to just get it done. I know, the weight that lifts off your shoulders, and, over the 300 people that registered for this webinar, you're already taking step one, which is, getting the information, and you're already on that road. I always think it's harder to get moving than it is to keep moving.
Right.
And so it's like, now that you're here, and I commend all of our attendees for being here, now it's like, take the next step. Meet with Melissa, meet with Cona, meet with Stu and his team, take that next step. You don't have to make a commitment, but at least know, the more that I know, I feel more empowered. Mm-hmm. And more like that I'm able to protect my family. Right. So, that the more you speak and how complicated it can be and how unique it is for each person, you realize the importance of the pre-planning.
Yeah. And that's why we believe so much in the education, right? Just doing these webinars, getting the information out there so people know what they could potentially be up against. And, sometimes people are uncomfortable. They'll say to me, you know what, Melissa, I don't want to put my bank account into an irrevocable trust because I want to use it, right? And once you put assets into an irrevocable trust, you don't really have access to them anymore. But the nice thing about living here on Long Island is usually our largest asset is our home. And putting that into an irrevocable trust is kind of a it doesn't do anything. It doesn't change anything. So people are very comfortable doing that and knowing I'm protecting my largest asset for my family. So it's again, like you said, it's every case is different. Everybody's situation is different.
Sure.
If I could add in a couple of just pointers that I think are important for everyone to know, most individuals, when they're making decisions for facility-based care, whether it be for assisted living or whether it be for skilled nursing care in a nursing home, most individuals actually, it's geography. It's close to home seems to be the most important. It should not be the most important, but we recognize people want to be near their loved ones and it's convenient. But it's not always the right decision to make, but the published literature says that. We're in a region where there are a lot of options for us, so we don't have to go with geography per se. Assisted living, for example, we all have many of them in each of our communities, and the number of assisted living units are growing, day by day. So things that should be looked at are, and not for assisted living, not just the monthly cost of what a facility will be, but knowing if someone is going to maybe need more levels of care. We call them care levels. If they're going to need assistance with medication management, with bathing, whatever it might be, these are additional services that usually an individual can purchase for their loved one, or they can purchase for themselves. So that could get expensive, right? Because it could be well beyond what the monthly fee is. Another pointer for everyone when you're shopping around and you're talking to other assisted living facilities, find out what their history has been in terms of their annual increase, rental increase. We all have cost of living and want to make a necessary adjustment. And some increase by just 3-4% per year, and some increase by 8 or 10% a year. So it can be very misleading going and thinking, okay, it's going to cost me X thousand a month, but fast forward 12 months, right? We have many individuals in our assisted living facility. They're with us from the beginning. They're with us for 20 years. They were 80 and now they're 100 plus. So planning is very important because we're all also living longer, and therefore the need to plan is so much more important. If you're looking at nursing home care, we all know there's a 5-star rating that exists. That's important. It can be misleading. So you have to be careful when looking at 5-star. One incident.
Why is that?
Because one incident, the way it's calculated, just one incident in a facility, one unfortunate incident can set back a facility by 1 or 2 stars for a 2 or 3 year period. So it can be very, very misleading. So the best facility could be a 3-star facility. What one needs to look at is within the 5-star program, call it a program, there is a quality component of 5-star. You want to be at a 4 or 5-star quality component facility. So you have to dig just a little bit deeper. 5-star information is public information. It's easy to find, but you have to just look within and know what you're looking at. I would not necessarily recommend looking at past Department of Health surveys, because to a non-person in the field, that's a problem, because a minor issue could be 30 pages of citation. So it could be very misleading. I've had people, contact me saying, oh my God, I saw this awful report about this facility. What do I do? And I laugh and I read it and I said, okay, it's nothing. I'll explain what that means. So we have to be careful. Also, a lot of the public websites, Yelp and others, where people, put comments and post comments, you can't fully rely on that. It can be very misleading to care that's actually going on in the facility. So I hope that's helpful for individuals.
Yeah. So what is important? What are the things that we should look at?
So right now, because we're still in a COVID world, COVID protocols, what facilities are doing to prevent illness is key right now. Staffing is also key. The single most challenging issue we all have in this business now, any home care agency, I don't care who you are, any nursing home, any facility, is staffing. Right now, we have an acute shortage of nurses and nursing assistants. The population is aging. There are more choices out there. Staffing is critical. Staffing was tough before the pandemic, but sadly, what has happened, and I often speak in the media, and this is one of the issues I speak to, is that now, a year later, people are making decisions, choices that maybe they don't want to do this anymore. Maybe they sacrificed and it's been very, very hard. And maybe they put themselves and their family at risk just being in a facility-based institution. So they're changing their mind a year later. We didn't see it a year ago. A year ago, we saw people who were sick and afraid and not coming to work, those types of issues. Now we're seeing people who are making lifetime choices, or they're relocating out of areas and out of cities. It's very, very serious. And now there are staffing standards that just got approved by the legislature 2 weeks ago that are also going to make it very, very hard for any of us to be able to recruit and boost staffing levels. So I think we're in for a very rough time ahead. I don't think we are through the difficult days. The general feeling in the public is, oh, things must be good now, you must be relieved, all is well. No, the real work now begins for many of us in facilities who are trying to deal with the financial impact of it all. And also now, what are we going to look like and how are we going to recruit? Do we have to change our businesses because of that inability to recruit?
So what else should someone look at? So obviously you need to look at staffing, what goes into the staffing. I would think also the experience and the breadth of facilities and available assistance, different modality, different healthcare modality. What would you say would be, if you were giving your best friend, your closest family, their biggest tip on what to look for in assisted living, what would you say?
Well, in assisted living, certainly I'd want, security, privacy. Those are things that are very important. And what other resources are there should they be needed? Mm-hmm. So, for example, someone who maybe chooses Gurwin as their assisted living choice, should their loved one now all of a sudden need an aide, will the facility allow an aide to come in and provide additional services? If you come here, we have a certain benefit in that you can utilize one of our two agencies to provide care within the assisted living facility. And then if someone should need to be here in the nursing home, they can have that as well. We're now in the process of building an independent living community. Construction is going at a very rapid rate. It's called Fountain Gate Gardens. That will bring people into our system even earlier now as independent living residents, with an option to buy a care option that would guarantee them coverage for the rest of their lives. And the children of those older adults who are making that decision are very happy because they have a sense of security coming to a system like that. The negative, and to be honest, and it's something I commented on before, is during a COVID situation, sometimes bigger isn't always better. It's a challenge. So we recently, as you know, acquired another facility. You mentioned Island Nursing and Rehab Center, which is in Holtzville, just 15 minutes east of us. And we stayed the course. We made it work even during COVID. Wow. That's been very helpful to us because we have individuals who they won't be able to visit their loved ones with the visitation restrictions. And we educate them very seriously. And I do this all day long, is consider the other facility. We've now been operating it for some time. It's a very good place, like I believe we are here, but you'll have a better chance of visiting your loved one there. Smaller means the odds are greater. You'll get to a point you'll be able to visit more easily and see your loved one. Bigger places, it's just more challenging. Lots of restrictions that we have on us. So it really depends on COVID, non-COVID, and what's important to you.
It's exciting though with Gurwin that you have all these different options, and that everyone can see in you, Stu, how compassionate you are. But having a place that you can go to that can provide all of these different options at different stages of your or your loved one's life is a huge benefit.
I'm always, we're always speaking to individuals who may have their loved one in another facility, and maybe they want to come to Gurwin, or they're going there, another facility first because they had the available bed at that time. The advice that I will always give someone all the time, if they are safe and satisfied and comfortable with the care provided, don't unnecessarily move someone. Selfishly, I'd love to tell you, come here, we'll help you, we'll guide you, but that would be the wrong advice. The best thing is if someone's comfortable and things are going well, because you don't realize how traumatic it is to the individual who's the resident. It's amazing what happens to individuals who are fairly young and go from facility to the hospital or home to the hospital. They just change. It's dramatic, and they can bounce back. But you don't want to put someone through that. So very often the advice I'll give is close to home, because I know that's what people want, and don't keep moving someone. You try to work through, and ultimately, hopefully, you'll have satisfaction with the care being provided.
Great advice. Great advice. Melissa, before we get to our Q&A, I know we have our attendees are chomping at the bit. They have a lot of great questions. But Melissa, I wanted to ask you the same question. You know, your close friend, your family, what would be the big piece of advice that you would give to them?
I think ideally the biggest piece of advice would be to plan early. And when I say early, I mean anybody who there are reasons to plan for everyone at different stages of their lives. You know, even a young couple who has, you know, young children and maybe, you know, hasn't really accumulated any wealth yet. They have those children. They have to make sure there's guardians in place for those children. And as you know, you go through your life and things change, you get married, you buy a house, you know, you need to look at your plan. And so planning early and kind of making it part of just your life and who you are is the best advice I could give anybody, because doing any of this in a crisis, and I think people are really learning this from COVID, because we're seeing more and more younger people planning, getting powers of attorney and healthcare proxies. Doing this in a crisis is just really, really difficult. I mean, I can't really stress it enough. So that would be certainly my biggest piece of advice.
That's great advice. That's great advice. My 9-year-old was asking me, when should I start thinking about this? I said, well, you may be
a little early,
but I like the way you're thinking. All right, so let me get to we have some wonderful questions here. Let me get to some of those. So Marsha wanted to know, am I hurting my mother's eligibility if I'm listed on her checking account?
Oh, that's a good question. Okay, so it's mom's checking account, it's mom's money, and you're listed as a joint owner. That's not hurting her eligibility, just that you're on there as a joint owner. Sometimes people get concerned that if you're added on the account, Medicaid is going to call that a gift, because now you're putting somebody on who has access to the funds. I don't see that quite as much. I probably wouldn't jump to put people on like right when they're about to go into a nursing home. But, you know, really the argument that I would make in that situation is, listen, this is for convenience purposes. My daughter is on here, so she can pay bills. She can, you know, things like that. If it's the other way around, then you put mom on your account, then you can have some major issues with whose money is it? Does it belong to mom? And problems like that. So I mean, I would say as a general rule, I wouldn't do it, you know, as oh my God, mom's going to a nursing home, I'm going to put my name on all of her accounts right now. But if it's something that you've had in place forever and it's just a matter of convenience, I would say that's okay.
All right, great advice. Stephen wants to know, how does the new power of attorney impact getting the Medicaid application process moving forward regarding asset protection? And can you transfer your Medicaid from Florida to New York?
Okay, I'll answer the easy one first. You can't transfer your Medicaid from anywhere to anywhere else. You're going to be reapplying in that state when you get there. And rules are different from state to state. And I think somebody else had asked that. You know, everything is different from state to state. So it becomes difficult if you're moving somebody around. And I often will tell people, if your loved one is going to end up in New York, if they need a nursing home, because the whole family's here, then you need to make sure that you're talking to not only, say, a Pennsylvania attorney when you're planning, if that's where they live now, but also somebody in New York, to make sure that, you know, what you're doing is not going to negatively impact them later. So that does make it difficult, the state to state issue. The power of attorney, we have a new power of attorney coming into play on June 13th. Which is an awesome date because it's my husband's birthday, so I will never forget it when I'm talking about it. Makes it so easy. There's a new power of attorney coming into play, and it's really not going to negatively impact Medicaid. I mean, the truth of the matter is there's a section on these powers of attorney, the one that was the new one in 2010 and the new one now, where you can modify the powers. And that's really where you're getting your powers in about Medicaid. So the most important thing to do is make sure that you have an elder law attorney, estate planning attorney, doing the power of attorney for you. So those modifications get in there, but the new form itself is not going to negatively impact anything having to do with Medicaid.
Terrific, thank you. Diana wanted to know, if you're listed on your parents' lease, different from a bank account, does that hurt eligibility for home care services?
So parents are leasing, say, an apartment, and you're listed on the lease as another possible payer, or I'm not really sure, but it shouldn't have a negative effect. I mean, at the end of the day, it's a lease. There's not an ownership interest there for the parents. So it's having the child on there shouldn't really affect anything. My only concern would be that when we set up this pooled income trust for home care purposes, the idea is to preserve excess income, anything over the 884, to be able to pay monthly expenses. And one of those monthly expenses, if you're renting an apartment, is going to be your rent. And if there's somebody else on the lease, you could potentially run the risk of Medicaid saying, why are you paying the whole thing when there's somebody else on here? Mm-hmm. So again, not something that I would necessarily see happening all the time. But the other thing about Medicaid is, if you ask anybody who does this, it all depends on who your application is in front of, what county you're in, and who your application is in front of. And, it's kind of a luck of the draw with that. But that would be something that would concern me if a child was on the lease, is that Medicaid could say, why are you paying the whole bill, Mr. So-and-so? You should only be responsible for half of it.
Got it. And these are important things to make sure you bring up when, let's say, somebody meets with you. These are all bits of information you need to kind of put into the pie to think about what's the best advice.
Right.
We've gotten a couple of questions. People want to know, what you charge for a consultation, what would be the steps of the consultation, and what people could expect.
Sure. Right now we have no consultation fees. So people can call and make an appointment. We've been doing our consultations mostly virtually, but now in person as well, depending on your comfort level. And typically what we do is we'll get you on the phone with an attorney right off the bat. That's something that we kind of pride ourselves on. You will always talk to an attorney when you make that initial phone call, mostly because people are in crisis and they need someone to kind of just tell them it's going to be okay. We'll send you out a questionnaire to fill out. We'll book an appointment. Typically they last about a half hour, however much time you need. And then we go from there.
Terrific. So take advantage of that, everyone. It's a good opportunity. Dee wants to know, can you qualify for Medicaid if you have retirement funds that were rolled over from a 401k into an annuity account?
As long as it's an IRA annuity, which is a retirement, because it's retirement money. Okay. Annuities, Medicaid and annuities are funny, but non-qualified annuities, non-retirement annuities. If it's a retirement annuity that's typically labeled as an IRA annuity, then you're fine. Then it falls into that category of being protected.
Okay, great. Jordan wanted to know, does home ownership count towards getting Medicaid approval, or does it not come into play? They look at your home ownership.
Yeah. So in New York State, you can qualify for Medicaid with a home in your name. Okay. They will, as long as it doesn't exceed, I think it's $900,000 now is the value, some in that range. You can qualify. So if you have a home that's $500,000, you can keep it in your name. You can go on Medicaid. But what will happen is Medicaid will place a lien on the property. So when you pass away and your property is sold as part of your estate, Medicaid will get paid back. Some people are okay with that. Other people, will look, like I said earlier, to plan, being that that's typically the largest asset, not always. They'll look to plan to try to protect that asset.
Great, thank you. Wendy wants to know, what criteria should you use or ask about to choose the right agency to use to help you prepare the Medicaid enrollment process? So when she's talking about an agency, I mean, is that...
So there are people out there that are Medicaid, they call themselves like Medicaid advisors, but they're not attorneys. So, you know, that's always kind of a tricky question. For me, I feel like, you know, there's legal work to be done when you're applying for Medicaid, whether it's asset protection, whether it's documents that need to be created. So having an attorney complete the process really makes more sense, because you can run into things that require legal advice that you can't get from an agency per se. So, you know, that would be my kind of take on that. Is I feel, again, it's legal advice, it's legal work that is encompassed in it, and it should stay with the same individual.
All right, thank you for making that distinction. Someone wants to know, I know that a while back, New York State instituted a promissory note requirement. Is that still in effect? And can you talk a little bit about the circumstances requiring it?
Sure. A promissory note plan is kind of your crisis plan, right? That's the one where mom and dad, you know, have $500,000. Dad passes away, mom's by herself, mom needs to go to a nursing home, and mom never wanted to do anything with asset protection. You know, and that's the kind of story, like, I've tried, I brought mom to an attorney, we talked about it, she just didn't want to do it, she wasn't comfortable with it. Now she has $500,000 in assets and she's going into a nursing home tomorrow, and I'm going to have to spend all of it down on her care before I can get her on Medicaid, right? That's kind of that's that phone call where you get like the panicked phone call. So I always try to explain to people, just in the simplest way, we can typically preserve approximately 1/2 of somebody's assets if they've never done any planning and they're going to a nursing home tomorrow. And we do that through this promissory note plan. So it's not that a promissory note is required per se, but it's part of a plan. It's a planning tool to basically move assets to a family member, while you know, earmarking one of them as a loan subject to a promissory note and one as a gift subject to the Medicaid penalty, so that you're protecting half of it and using half of it to spend down on the care. It's complicated. It's like a lot to talk about, but I'm happy to go over it with anyone who has specific questions. But the whole idea behind it is we can preserve approximately 1/2 of what someone has, even in the most like last minute kind of crisis situation.
Terrific, thank you. Stu, can you speak to the difference between assisted living and nursing home?
Sure. Finally, a question for me. I was beginning to wonder, over 300 callers and nothing's coming my way.
You just said so much. Everyone was so well informed.
The Medicaid, Stu. It's the Medicaid.
Medicaid makes your head spin. So
Why we need experts like Melissa.
Absolutely.
So certainly the assisted living environment is really geared for someone who is more independent. You could have someone who is very independent, and they could go for communal dining, or they can prepare and have food in their own apartment. And it's a much more of a, I'll say, a relaxed residential setting. And in ours is typically, it's a private pay situation. So it differs quite a bit from the nursing home. But assisted living facilities do compete with nursing homes as well, because as people advance or have certain conditions, they might need additional supports, like I described before, including aid services. So someone could, in reality, keep someone who's got a lot of issues in assisted living with an aide, seeing a doctor routinely as they need, going out for all other procedures or appointment as needed. So someone can be managed. Very often, it's a matter of how independent can you keep someone, and also how are you managing finances? Are you needing to spend down monies and ultimately qualify for Medicaid and then enter the nursing home system? So I usually look at it as graduating steps. Some people take a bigger leap and bring someone to the nursing home because maybe they'll see in a few months that's kind of the way things seem to be going. Many people do, it does work that way. But as I said in the beginning, most individuals come into our system from the hospital. They'll typically come for short-term rehabilitation. Something will have gone on. They'll have had some kind of accident, whether it's a stroke, a motor vehicle accident, post-surgery, whatever it may be, and really need, I'll call it a tune-up in short-term rehab. And we'll do that. And that varies. Every situation is different. Someone might be with us a matter of days, and someone might be with us a matter of months. And many people then do go on to long-term care here or elsewhere. So I think it's really a matter of how much independence. And again, everybody is a bit different.
Great. Thank you for that distinction. And do you at Gurwin help people through that process? And like, let's say someone's in your assisted living, that's the new assisted living that you're building. And do the people there then take a look at the patient and make recommendations if they're noticing that they need more care or they should be in a different kind of facility? How does that happen as people kind of grow with you?
Sure. Well, in the independent housing that's being built, those are mostly going to be couples. And so something may happen to one of the individuals within the couple, and then they would likely reach out to us saying, he's not quite the same. I think we might need some help. And we'll be educating our staff to be attuned to that. Because again, we don't want someone to be in an environment that's not best suited or not safe for them. It's not good for them. It's not good for us as an organization. So we have to do a good job of recognizing that. But independent housing is truly independent, like you are buying your own home and living somewhere. But we know that behind the scenes, there is a healthcare component that is available and accessible to all. Assisted living, that's where there's a lot more care and queuing being introduced to those who live there. And obviously in the nursing home, it's full care. We've all become more complex type providers in nursing homes. So we kind of resemble hospitals more so than ever before. So again, it's almost like graduating levels from one to the other.
Thank you for making that distinction. So before we go, we could stay here all day because there's so many great questions. But before we go, Melissa, if you could share with us, what should people look for when choosing a legal team in their elder care needs and estate planning?
Yeah. Well, I would say that what I like about what we do and why I've stayed here as long as I have is, there's so much going on in this type of situation. It's not just about knowing how to do a Medicaid application or knowing how to write a trust or how to protect assets. It's about working with the family. It's about working with people who are in this emotional, hell, and they need guidance and they need someone who's going to listen and they need someone who's going to make recommendations and think outside the box and who have resources like Stu who can collaborate with them and help them come up with a plan. It is certainly not, like I said, just about call, make an appointment, come in, do your paperwork, have a nice day. There's so much that goes into it, and that is what I think is so important for people to look at. When it comes to, obviously you want someone who's, in the field, who's known, who does does this work and does it well, but there's such a bigger component of that compassion and that desire to help, really.
I'd like to add on, if you're looking at facility-based care, ask those individuals. When you're on a tour or you're inquiring, ask them, if I need an elder law attorney, can you recommend someone to us? And chances are the company or companies that get recommended, like against Cona, are typically going to be someone who's responsive, who's going to be fair in terms of their pricing. Not everyone's fair and not everyone is easy to access and follow up. It's some, are much better than others. So asking them who they recommend, who has a greater success of getting Medicaid approval and timely. Who has more relationships, with others in Department of Social Services who can help move the process along. So we're really the right people to ask those questions.
Yeah, having that experience, that expertise, and if you subscribe to the Schneps Media YouTube channel, you're going to see behind the scenes, and you're going to see Melissa's compassion and really her why of what she does. Really it means so much more than just a job, but really caring about people coming to see her and her lifting the burden off their shoulders. So go check out on our YouTube channel. Not only will you be able to see this has been recorded, so you'll be able to see it again and again and share it with your friends and your family, and please do so. But you'll also be able to catch some behind the scenes with Melissa and Stu and learn a little bit more about them. So please check that out. I have shared both Melissa and Gurwin's contact information. So please do reach out. You've taken that first step. You've showed up here. Now take that next step and keep that ball rolling so that you can prepare and feel that burden lifted off your shoulders. I want to thank you so much, Melissa, Stu. Really, thank you so much for sharing your time with us, your expertise with us. And I want to thank all of our attendees for spending some of their morning with us. Please tune in to our future webinars and have a wonderful day. Stay safe, stay healthy, and enjoy that sunshine. Have a great day.
Thank you.
Thank
Have
you.
a great
Bye,
day.
everybody.
Thank you so much. Bye-bye.